Hello and welcome to Your Pregnancy. I'm Sue Elkind, and today's practice that we're going to do will be very calming and grounding to your nervous system. It's going to be a very small hip opener sequence that you can do at any time of your pregnancy, at any trimester. So we're going to begin right now in a comfortable seat, and you can grab a little prop to sit on. We'll place one hand to our belly and one hand to our heart. And we'll begin by finding a deeper breath we call Ujjayi breath, which is through the nose into the back of your throat. So let your eyes close and begin to deepen your breath. See if you can hear the sound of your breath like a whisper. As the breath comes in, let it stretch a little further inward into the very center of your heart. As the breath goes out, start to settle your awareness downward, and remember that you're practicing together, you and your baby. This is a very special time. On your next deeper inhalation, see if you can take your breath all the way to your lower hand. Expand the breath into your belly and let it rise up into your heart. And as you exhale, soften your heart. And then soften your belly. Like a wave, we'll do that again. Inhale from belly to heart. And exhale from heart to belly. One breath that's feeding two hearts. Let's do that just one more time. It feels so good. It's a great way just to pause from the rest of your day and just remember to nourish yourself and your baby. Beautiful. Now begin to open your eyes, and we're going to stretch the arms wide and reach them high and even look up to the sky. And as we bring our hands straight down to our heart, we make that great gesture we call Anjali Mudra, which is the gesture of offering. And so whenever we practice yoga, we make it an offering to ourselves, and while we're pregnant, to ourselves and our baby. Whatever it is for you today that you want to dedicate your practice to, maybe it is to feel more calm, more at ease, more at peace. Bring it into your breath, into every cell of your body. And we'll release the arms, and we're going to take the right hand down and stretch the left arm up to the sky. Deep inhalation. As you exhale, we'll just side stretch over to the right. And inhale on up. We'll take that left hand down. And exhale all the way over to the right. And back into center. One more time. Inhale. Keep your hips grounded. Keep your waist back so belly draws in just a little hug in for baby. And then other side, your hips are grounded. Your spine is long. Exhale your way over to the side. Nice. And then back into center. We're going to stretch out our legs. If it's comfortable for you to stay on your prop, you can. We call this pose extended side wide angle, Upavishta Konasana. Flex your feet, ground your heels, and squeeze the muscles of your legs on all sides. Inhale, again, reach your arms up wide and high. As you exhale, we're going to take the arms towards the legs, and this time in the front of the legs, start to walk the hands a little bit forward. Keep your legs strong, squeeze the tops of the thighs to the earth, and just take a few deep breaths into the backs of your legs. You can even soften your heart, staying even a little more upright at first perhaps. If you have the flexibility, you can start to walk out a little bit further. Take a few breaths here. Depending on your flexibility, again, you'll go, or depending on how far along in your pregnancy, you'll just go as comfortably far as you'd like. And then inhale, walk yourself back up. Take your right knee, hold the inside of your knee, point your right foot. And now we're here just with the right leg bent, the left leg straightened. We'll do one more side stretch here. So bring your left hand down and inhale your right arm up again. And we'll walk it all the way over to that right side. Bend your top arm, place your hand on the back of your head, bring the elbow in a little bit and take your arm bone back. And engage your upper back. Squeezing into the upper back, push your head back into your hand and just turn your torso open. Try not to strain. So we still hold a little bit of support in our center, And that gives us a little more tone in our transverse abdominals, which will help keep the baby, the abdominals from separating. Keep the baby closer to you. Good. Inhale, come on up. And we'll try the other side. All right, right leg straightens, left leg bends. Right arm down, left arm high. Deep breath in and take it over to the side. And again, just let your hand rest on the back of your head. Push your head back and open the heart up. Take a breath or two. Right into the places that feel a little tight. Ground into your foundation. And if it feels good, you can turn your gaze upward perhaps. Maybe walk the hand forward a little more. And then inhale all the way back up. Good. We're going to take the soles of the feet together. We call this one Baddha Konasana. You can turn your thighs in a little wide and your sitting bones back. Fingertips can come back behind you at first. Lift your shoulders up and take a deep breath in. As you exhale, come in a little bit. Lean into it. If your knees are higher than your hips, maybe elevate your hips a little bit more on a prop. If your flexibility allows, bring your hands now forward and walk yourself forward. And depending on your trimester, you want to move your feet forward and maybe even out a little bit. And then there's a little more space for baby. We always want to make space for our babies. And as we're breathing here, allow the sound of your breath just to help you once again. Just breathe in more calm, more peace. And know that while you're breathing, you're feeding that very same expression, that same feeling into every cell of your babies. As you inhale, walk yourself back up, and we're going to stretch the legs out in front and keep them still a little bit wide, maybe shake it out. Place your right ankle. This one might be a little harder, so it might not look just like this. You might just modify. We'll show you how. Take that left foot under. So if your shins don't stack like this, you can always take your bottom foot and bring it in a little bit more. You can always cross your ankles a little bit more, sort of like a seated position, or elevate your hips. All right, so if you can come into this one, it is a deeper hip opener. Once again, and exhale, we'll walk it forward and just take a few breaths here. Again, as we hear our breath, it helps us just to calm the mind. And as our breath deepens, it stimulates even the vagus nerve and the diaphragm expanding, and the whole parasympathetic nervous system starts to kick in, and that helps us to move more into that relaxation response. Anything you can do to relax, even your jaw here, and just soften any tension in your face. The energy can start to ground a little bit more, and that kind of tension in the hips can start to dissipate. As you inhale, come on up, and that's sort of what we need to do to kind of get our babies out eventually, right? We have to open our hips. We'll try the other side. Walk your bottom foot underneath your top knee, widen your seat, your sitting bones, take a deep breath in. You might just sit upright. If you can, you'll go in a little deeper. So I recommend trying to get on the floor rather than on furniture. It's a really good idea, and it helps us to open the hips. So when you're watching a movie or you're paying your bills or whatever it is you're doing, instead of sitting down all the time in a chair, put yourself on the ground and just see if you can kind of open up this area a little bit more. A few breaths here. Lean into it if you'd like. Try to keep the shoulders lifting though, so you just keep good posture in the upper body and everything we do. Good. Inhale, come on up again. Good. Now we're just going to cross the legs like we began. And without even having moved our body that much in different positions, you might already notice a feeling a little more space in the pelvis. We want to create that space in the hips and less congestion in the pelvis. So hopefully already you feel like you've put a little more rejuvenation and a little more relaxation into your day. So we're going to end actually the same way we began. Close your eyes and just check in again on your breath, and just notice perhaps if you can take a deeper breath with more ease. And notice perhaps that feeling more at ease, there's a part of us that also just feels more alive, maybe more present. And the way we feel when we're in this space is an amazing gift to give to our baby growing inside of us. Because we know that we are our baby's first teacher. And so when we're willing to take even 5 minutes, 10 minutes out of our day to deepen our breath into the places of the body that tend to get tight and tense, we know that we're feeding this new life with an amazing opportunity of just a new start, new experience when they become in this world, when they are sharing this beautiful world outside with you. We'll bring one hand to our belly, one hand to our heart. And let's just finish here just like we began. From belly to heart, and from heart to belly. Offering any last little beautiful thoughts to the baby. Let your baby even express whatever it wants to you, and you just listen. Pay attention to all that little guidance that comes in. And then we finish our hands in that same gesture we call Anjali Mudra, and we can bow our head in towards our heart, always in gratitude for this great time that we have of greater connection. And we finish just saying the beautiful Sanskrit word namaste, which just simply means that the light in me salutes the light in you. Namaste.